So in this video we will discuss about pharmacokinetics. It is the study of how a drug moves in the body. This is the body and this is the drug. So this how the drug moves inside the body, that study is referred as pharmacokinetics. Like the how the drugs moves into and through and out of the body. This essentially the how the pharmacokinetic travels inside the body and what happens. So what the body does to the drug and what in this whole course what our body, how the body responds to this what how it affects, or how what kind of effect on the drug happens due to the body. That study is referred as pharmacokinetics. So pharmacokinetic is the study of a drug movement into, through and out of the body, and essentially what the body does to the drug. It determines the onset, intensity and duration of a drug's effect, and this is basically discussed or maybe determined by by the major process, which is also referred as ADME. A for absorption, D for distribution, M for metabolism, E for excretion. So this absorption, it's the movement of drug from the site of administration, from the site of, suppose this is the one site and here it is administered. So the site of administration, maybe it might be oral route or maybe intravenous or maybe other rectal or some and the drug moves from the site of administration into the bloodstream. So this is the bloodstream. That's called absorption, and it is influenced by route and formulation, various routes like oral or IV, etc., and the type of formulation of the drug, the chemical property of the drug, or even there might be some food drug interaction. And the oral drugs may undergo various first pass metabolism. We will discuss what is first pass metabolism later, and reducing the absorption and bioavailability of the intravenous drugs. In generally intravenous drugs have 100% bioavailability. So we will discuss this in detail, like what is first pass metabolism and how it reduces the absorption and bioavailability, and why intravenous drugs have 100% bioavailability. Next is this distribution. So this distribution refers to the dispersion of the drug throughout the body fluids, how it disperses in the biofluid like blood and tissues after entering the blood stream. So the movement of this drug from the bloodstream inside the bloodstream, as well as how when it reaches to the body organs, suppose there are various tissues. So the movement of this drug from the body fluids to the tissues, this is referred as distribution. How it is distributed inside the body fluid like bloodstream, and when it reaches to the organ system. And this is affected by various factors like blood flow or even tissue permeability, and then plasma protein binding, volume of distribution, and some drugs reach highly perfused organs first, for example brain or even liver. Then there is a metabolism, concept of metabolism. So the chemical alterations of the drug, mainly in the liver, to facilitate elimination, that's referred as metabolism, and it involves phase 1 and phase 2 modification. For example, phase 1 there is a phase 1 which is also referred as modification, and phase 2 which is also referred as conjugation reaction. They can activate or inactivate or make drugs more water soluble for excretion. Then there is a excretion, which is referred to the phenomena of removal of the drug and its metabolites from the body, primarily via kidney, like through urine or even the bile, for example fecal material. So there are other routes including like lungs, volatile drugs, and sweat, or even like saliva and breast milk. So and there are various ways of excretion, and the renal function and the drug properties influence this excretion system. So overall, the pharmacokinetic is the study of the drug movement inside the body, and how the body and what the body does to the drug. and it is controlled by various factors which is referred as ADME, in short, absorption, distribution, metabolism, and excretion. And just to sum it up, absorption is the movement of drug from the site of administration into the bloodstream, and the distribution, it's mainly refers to the dispersion of drug inside the throughout the body fluids and tissue after entering the bloodstream. And the metabolism, this metabolism, it's basically refers to the chemical alteration of the drug mainly in the liver to facilitate elimination. And the final one is the excretion. In excretion, it involves the removal of drug and its metabolites from the body, primarily via kidney or even as a urine and or biles, for example fecal material.